Harlequin ichthyosis is a rare genetic disorder of the skin, one of 20 types of ichthyosis and the most severe. Harlequin ichthyosis is an autosomal recessive congenital ichthyosis inherited by 2 recessive genes. The genes involved are believed to be the ABCA12 gene involved in transporter proteins that encode epidermal lipids across the epidermal cell membrane. This form of ichthyosis is present at birth, with the infant covered in thick plates of scale that tighten and can restrict movement, interfering with essential functions such as sight, breathing, and hearing. These scales distort facial features, especially around the eyes, causing ectropion, or the eyelids to turn out, as well as the mouth, known as eclabion. The tightening caused by the scale can cause breathing and eating difficulties. Hands and feet may swell and split, causing deep fissures that risk infection. Infants born with Harlequin ichthyosis are often premature, requiring neonatal intensive care. They also are known to have a failure to thrive. The barrier impairment associated with Harlequin ichthyosis leaves patients unable to regulate their body temperature. The increased transepidermal water loss can easily lead to dehydration, and infants will require high humidity incubators. As these patients age, full covering of limbs and the body is required even in the warmer months of summer. Harlequin ichthyosis is thought to occur in 1 in 1 million births, with low survival rates in the past. With advancements in modern medicine, we are now seeing people living with Harlequin ichthyosis into adulthood and now starting families of their own. As Harlequin ichthyosis is a genetic disorder, there is no cure. Treatment is centred around protecting the skin's barrier and preventing infection. Low-dose oral retinoids can be introduced as early as day 3 after birth to encourage shedding of the thick, like armour scale, and allowing movement and softening of the skin to prevent infections and allow function. In combination with these oral retinoids, skin management includes a daily bathing regime with gentle debridement of the scale using ointments and sometimes keratolytics, often twice a day. Ointments, sometimes with urea in a paraffin base, are applied to the entire body, including the scalp, up to 3 times per day. Ophthalmic care is required for ectropion and to avoid the eyes drying out. The skin is our largest organ and plays a significant role to protect our body. Harlequin ichthyosis is a condition of the skin that causes a rapid turnover of skin cells and an impaired barrier. The body is working harder and therefore will require larger amounts of iron, minerals, and protein to support growth and function. An increase in calories with nutrient-rich foods will be required. Physical therapy is required to ensure free range of movement and prevent contractures. Fortunately, Harlequin ichthyosis is a rare dermatologic condition. Patients will require collaborative ongoing care between their primary carer, dermatologist, dietitian, ophthalmologist, physiotherapist, and ear, nose and throat specialties for a lifetime.